Coalition of healthcare worker groups, including the Progressive Healthcare Forum, believes the block exemption approach will not pass legal challenge. It's also questioned the department's control over tariff setting instead of an independent body and the effectiveness of a piecemeal approach to implementing the HMI recommendations.
I think the upshot of that is that you can't pick and choose out of a package of recommendations, regulatory recommendations out of the HMI. Which is exactly what they've done here, and they've done it poorly, and they've done it manipulatively. And as a word to the wise in the government, withdraw these as soon as you can.
They argue that the public healthcare system has been allowed to steadily decline over almost 2 decades due to the inaction of government. This while the private healthcare system also faces sustained market failure pressures as the population it serves has not grown given the sluggish economy. Speaking at a webinar on the draft regulations open for public comment, Wits governance professor Alex van den Heever explained that the HMI recommended establishing a multilateral negotiating forum within an independent supply-side regulator.
What is required going forward is that a properly legislated multilateral negotiating forum needs to be considered. The creation of the supply-side regulator should be considered. The integration of hospital pricing reforms need to be also dealt with, and the establishment of the risk equalization mechanism, together with all the other measures, which are important in basically making sure that the purchaser side of the system actually has an incentive to contract efficiently, which they don't have at this point.
The UHAC is urging governments to initiate a formal legislative process to holistically implement the HMI recommendations, addressing both pricing and demand-side issues. Nosipho Khatebe, SABC News, Johannesburg.